Chapter 1: The Failures of Psychiatry. Is psychiatry truly the panacea for mental health issues, as it is often portrayed, or has it become a glorified pill dispenser? As we delve into the world of psychiatry today, we find a landscape riddled with failures and disappointments. Consider the case of Jane, a 35-year-old woman diagnosed with clinical depression. Jane had been on a cocktail of antidepressants for over a decade, yet her symptoms persisted. Despite the countless hours spent in therapy and the myriad of medications tried, her mental health never improved. Jane's story is far from unique. It's a narrative shared by millions around the world, raising the question, is psychiatry failing its patients? Then, there's the story of John, a veteran battling post-traumatic stress disorder. Psychiatry offered him a lifeline of medications to numb his pain, but it never addressed the root cause of his anguish. The pills only masked his symptoms, leaving him in a constant state of limbo between pain and numbness. John's case highlights the shortcomings of psychiatry's one-size-fits-all approach to mental health. Let's not forget about Sarah, a teenager diagnosed with bipolar disorder. Her psychiatrist prescribed her a series of mood stabilizers, which instead of stabilizing her, left her feeling like a zombie. The medications robbed her of her emotions, her personality, transforming her into a mere shell of her former self. Sarah's case underscores the devastating side effects that psychiatric medications can have, further emphasizing the failure of psychiatry to provide holistic care. Chapter 2: The State of Psychiatry Today. So, what do these stories tell us about the state of psychiatry today? Firstly, psychiatry often relies on a reductionist approach, treating symptoms instead of addressing the root causes of mental health issues. This approach not only fails to provide long-term relief but also leads to a cycle of dependency on medications. Secondly, psychiatry's over-reliance on medication neglects the importance of psychotherapy. Medications may alleviate the symptoms, but therapy can provide the tools to manage mental health in the long run, fostering resilience and personal growth. Lastly, the side effects of psychiatric medications can sometimes outweigh their benefits. They can rob patients of their emotions, their personalities, leaving them feeling like mere shadows of their former selves. In conclusion, psychiatry, as it stands today, seems to have lost its way. Instead of being a beacon of hope for those struggling with mental health issues, it has become a purveyor of pills, offering temporary relief but failing to provide sustainable solutions. It's time for a change, a shift towards a more holistic, patient-centric model that prioritizes understanding and healing over symptom management. Only then can psychiatry regain its rightful place as a vital instrument of mental health care.